There was an infamous medical trial that took place in the United Kingdom in the 1980s, which has been referred to as the AIDS Orphans Drug Trials or MRC 958. The trial was conducted by the Medical Research Council, MRC, a publicly funded research organization, and involved testing a new drug called AZT on children who were infected with HIV and living in care homes. AZT was known to have significant side effects, including anemia, muscle weakness, nausea, and vomiting, which were observed in both adults and children. In the case of the MRC 958 trial, there were reports of some children experiencing side effects such as severe anemia and neutropenia, which is a condition characterized by a low white blood cell count. In addition, there were reports that some of the children who participated in the trial died while the trial was ongoing. The exact number of deaths is disputed, with some estimates suggesting that as many as 19 children died during the trial, while others suggest that the number was much lower. However, it's important to note that the children who participated in the trial were already very sick with HIV/AIDS, which makes it difficult to determine the exact cause of death in some cases. The trial has been widely criticized for a number of ethical concerns. One of the most significant issues was that many of the children who were enrolled in the trial were orphans or wards of the state, and therefore were not able to give their consent to participate in the trial. In addition, there were concerns about whether the children received adequate care and attention during the trial, and whether the benefits of the drug outweighed the risks, particularly given that AZT was known to have significant side effects. There were also questions raised about the level of informed consent provided to the children's guardians or carers, and the extent to which they were aware of the potential risks of participating in the trial. Some critics have also suggested that the trial was motivated more by a desire to test the drug than to provide the best possible care for the children. The trial eventually came to an end after a number of years, and the results were published in medical journals. Although AZT was found to be effective in slowing the progression of HIV, the trial remains controversial to this day, and is seen by many as a stark reminder of the need for strict ethical guidelines when conducting medical research, particularly with vulnerable populations.